Hello, thanks for listening to this edition of the After Hours Skin Clinic with me, Dr. Emma Craythorne. This is the home of relaxed late-night skin talk that's as entertaining as it is informative. And in this episode, we're talking all about men's skincare. And I am so delighted that I'm joined again by my dear colleague and friend, Dr. Ellie Rashid, another consultant dermatologist.
Hello, lovely to be here.
It's so nice having these conversations together. I feel like we're really taking the clinic home with us.
Yeah, I know. It never stops.
So this episode is going to be based around men's skincare. And it kind of came to me whenever you'd written that amazing article for GQ magazine. I thought, that's something we probably need to have a chat about on the podcast.
Yeah, so I've done an article of GQ magazine with a very catchy title of How to Shave Your Armpits Like a Marvel Superhero. And it was aimed at how men can improve their shaving technique to reduce the incidence of things like ingrown hairs and getting like shaving rash and bumps and irritation.
So they want to shave their armpits?
Yeah.
I didn't know men shaved their armpits quite as much as women do.
Yeah.
I did not know that.
Yeah.
I'm obviously with a very hairy man who never shaves. Well, apart from his face, which he shaves every day. But that is one of the issues, I suppose, whenever it comes to men's skincare, is that, there are big differences between men's skin and women's skin. And it's basically because of the more testosterone in men and the act of that on the skin, making the skin thicker. It's got more collagen. Lucky them.
Yeah, they've got bigger pores.
They've got bigger pores and they've got coarser hair on their face. Of course, women have hair on their face too, but generally it's very tiny little baby hairs, although there are coarse hairs that can appear, particularly in the lower face from time to time. But it's really men that have that beard that grows and then shaving it, every day for many people.
Yeah, although it's become trendy to have a beard now.
I know, but even the beard must cause problems. Should we delve on into men's skincare?
Yeah, let's do it.
So what are those main differences then, do you think, that men have compared to women whenever it comes to facial skincare?
So in terms of the differences that we've already talked about, they have thicker skin, more collagen, bigger pores, sometimes an oilier skin type. And so the biggest problem that I see in clinic with men is usually related to their beard hair. So it's related to getting shaving bumps and irritation or bumps around the back of the scalp. And then I also see men a lot with acne, and they seem to have more backne, and they can get a bit of acne on the chest and on the bottom. And so I think because they've got that oilier skin type, they often need a recommendation for how to improve the oil on their skin and how to improve those skin conditions that they're more susceptible to getting.
I mean, I think that's right. There's this misconception, isn't there, that you're going to grow out of your acne whenever you're in your early 20s. And it's probably well known now that as women, you've got this entity called adult female acne, often related to perimenopausal times or coming off the pill. But actually, men continue to get acne sometimes for all of their life.
Yeah, for sure. I see men into their middle ages struggling with acne. And I think people are a lot more inclined to come and see a dermatologist now. Whereas before, I think dermatology was considered a cosmetic issue, something that people wouldn't see a professional for. But now, increasingly, men and women are seeing a dermatologist for their skin health.
Yeah. So if we think about because there's like a huge increase, isn't there, in men's skincare. It used to just really be, you'd just walk in and you would just see skincare that was aimed predominantly at women. But whereas now there is this increase in men's skincare products and men seeking to shave their arms like superheroes.
Yeah, they are. Well, some of the marketing is divided into like men's skincare and women's skincare. But actually, many of the ingredients that are in those formulations are applicable to men and women. It's more marketing, don't you think?
I mean, it is more marketing, really. You know what my take on this. The whole thing is entirely just down to marketing.
Yeah.
But I think because there are those differences. So yes, men have thicker skin and oilier skin, but actually some women have thicker skin and oilier skin.
Yeah.
And some men have thinner skin and not so oily skin. They've got very dry skin. So, it comes down again to really understanding the type of skin that you have that's specific to you. And the idea of just having something that says for men on it is probably not necessarily the best way of going to get your skincare product, just because it's in a black bottle rather than a white bottle.
Can't stand that.
I know.
It just annoys me.
It's like you having, your Outlook.
Yeah.
Do you want a black background or a white background?
Yeah. Yeah.
And all the girls have white and all the boys have black. So when we think about the needs for skin health for men, one of the generic things that we can talk about is shaving, because you touched on that, in your article about superheroes, but also, that is where people run into problems.
Yeah, exactly.
And being able to shave properly, I suppose, is one of the keys to it, isn't it? What is your advice if you're asking somebody to shave properly?
So I normally tell people to use like a shaving foam or a shaving oil or something, so there's less friction between the razor blade and their skin. Usually advise them, if they're getting the irritation where their hairs are sort of curling back in on themselves and they're getting irritated hair follicles, maybe they should use like a alpha hydroxy acid or something on the skin to try and exfoliate the skin, or a beta hydroxy acid. So something like lactic or glycolic in the alpha, or something like salicylic acid in the beta, just to exfoliate that top layer of skin so the hair doesn't curl back in on itself. One of the things that we really need to consider is the texture of products that we advise men use if they have got beard, like facial hair, because sometimes like a thick cream just doesn't go where we want it to go. It just sort of sits on top of their facial hair and doesn't absorb into the skin. So I normally advise like a gel texture or something that's more of a lotion rather than a thick cream or an ointment.
Yeah, I'm very similar. So my advice for shaving for men is actually, what's quite interesting is some of these original shaving foams that you can get, they're designed to slightly soften the hair. And sometimes when it gets shaved off, it sometimes softens the hair that's just underneath the surface. So then people or men who have a tendency to ingrown hairs, using things like shaving foams can actually increase that risk of that hair underneath getting stuck again. So things like the oils you recommend, and things like sometimes even these pH balance cleansers are good enough to lubricate the skin itself. And then shaving in the direction of the hair.
Yes.
Yeah, I always remember my dad shaving in the other direction of the hair, but it's actually shaving in the direction of the hair is the key thing to do.
Yeah. And changing the blade often.
Yeah, because you want a nice sharp blade, don't
Completely.
you? Do you make any recommendations on blades versus electric razors?
Usually they've come with their own preference. I think if people get issues with ingrown hairs, particularly on the beard area, then sometimes I'd advise an electric shave just to keep it short rather than sort of with a blade cutting the hair at the surface of the skin. And that can sometimes be helpful to avoid it being flush with the skin and then getting that irritation when the hair grows back.
Yeah, I think that's right. I actually just had a patient as well this weekend that we were filming with for the Bad Skin Clinic, who ended up, just as you described, having these bumps on the back of the head.
Yeah.
And you get the bumps on the back of the head and you can get them on the beard area as well. It's a folliculitis, essentially. And sometimes on the back of the head, don't they turn into these little scars, these little keloid scars. And in those situations, they're the ones I'd say as well, yeah, make sure you use your electric razor rather than the actual cold steel blade.
Yeah.
Because if things go deep in, then you're more likely to get those ingrown hairs again.
Yeah. I've had patients with that condition where they get the little scarring at the back of the scalp, think that their barber has used an infected clipper or infected pair of scissors or something, because they associate that with some sort of infection issue. But it's an inflammatory response and it can be treated. So it's really important that they come and see a dermatologist so we can see it, diagnose it, treat it.
Yeah, and this guy Ross, who came in, you can actually watch his story on the Bad Skin Clinic, because he had exactly that. He had all these tiny little bumps just at the back of his head. They're painful, itchy. He'd been there for 20 years, 20 years trying all different things. And then it turns into these pretty nasty scars that are uncomfortable. Itchy. The scars get bigger, then that promotes more of the bumps to form. You end up with blood on the collar of your shirt, and that goes on for 20 years. But actually, it's a treatable thing. He's treated in, a couple of months. Done. Gone.
20-year mystery solved.
So I actually ended up removing the hair because it was just in his lower hairline. Most people don't want to go to the effort of removing their entire beard, but that is something that you can do if you're having repeated problems with hair issues. What about for people who decide to not shave and they keep their beard? What kind of skincare tips and tricks do you suggest, or do you have any?
Yeah, so for those, it's more about the texture of any formulation that they're given. So it just has to be able to blend into the skin quite easily. My husband has beard. And so if I recommended something that was thick stick and an ointment, like a rich cream. It would drive him mad because it would sit on the surface of the skin. So he uses a lotion, and thinking about like a moisturising lotion that has SPF in it. Now, I never recommend an all-in-one moisturiser that has sunscreen in it, because I always say to my patients, you're never going to use enough to get the true protection from the sun that is advertised on the bottle. So if it says SPF 30, you're never going to use enough to get that SPF 30. So I always recommend a separate sunscreen. However, if I think a patient won't want a multi-step routine, then I just think, right, keep it nice and easy. Moisturiser with SPF, all in one. And the one that I'm really liking at the moment is by the Ultraist, their hyaluronic acid moisturiser with SPF in it. It just glides on really nicely. One step in the morning, done after you've cleansed.
So that's your top recommendation for someone with a beard, that they would be using that one?
Yeah.
Although, isn't a beard just brilliant for sun protection in the first place?
Yeah, it is. But people get patchy beards. And then if you don't put anything on the rest of you, like your nose, you're still going to be at risk.
And what about, because there's a condition that often people will get in beards, as you can get in your hair, and it's aligned with dandruff, so seborrheic dermatitis.
Yes.
And one of the treatments that we always recommend for seborrheic dermatitis, so if you're thinking about that, just think about dandruff.
Yeah.
And it's actually an oily skin condition. It's not a dry skin condition. So even though you see the scales of dandruff, and you can also get this between the eyebrows, on the eyes, and then it also sits around the beard area. And particularly in the beard area, you don't necessarily see it as the dry bits of dandruff, but you can see the patches of red at the base of the beard, so on the skin, and often it can shine through. But the treatment for that, I just think, is exactly the same as the treatment that we recommend for scalps. So it's using Nizoral, which is the brand name, or ketoconazole shampoo. And you do this by applying it to the skin. So you're not applying it to the hair, you're applying it to the skin. So whether it's your scalp or on the facial skin where the beard is, and you leave it for a couple of minutes, and then you rinse it off, and you do that about 3 times a week. Then that's usually enough to keep this dandruff or the scaliness and the redness under control. Do you recommend that too?
And what's really funny, my brother, I remember, he didn't know what the diagnosis was. He's not a medic. And he was like, Elle, there's something going on with my beard. And then he was sitting at the dining table that was glass, and he just ruffled his beard and then showed me all this flakiness that came off. It was like, what is this? What's happening? And then I made the diagnosis. And I think Nizoral shampoo is brilliant for sebderm.
It is, but you can see why then people think it's a dry skin condition, because these dry skin.
Yeah, and we associate things like eczema or like dry, flaky, scaly eczema. But this is related to the yeast that lives on our skin called Rosacea, and it thrives in an oily environment. And the other thing to avoid doing, this is more for people with long hair, I guess, but if you go to bed with wet hair, that sort of environment that's damp and then it becomes oily, and then the yeast really thrives in that type of environment.
It's the kind of thing that you see a lot on sports people, isn't it? Sportsmen and women.
Yeah.
Because of the hot environments that they kind of work in. I would say the vast majority of footballers that I've ever have to look after and examine, very common condition for.
Do you remember we went to that
athletes.
party, the Welbeck party, and there was this guy that came over to us and was like, oh, dermatologist, great. And then showed us his skin. And we were like, sebderm. Diagnosis on the spot.
In tandem. But it really is probably one of the most, I would say, the most common condition that I would see in men.
Yeah. That and acne.
More than acne, I would say, more than rosacea.
I probably still see acne a bit more. I don't think many men with, my brother would never present to a dermatologist. I know that,
I'm not talking in my clinic. I'm talking on the bus.
Yes, totally. Yeah, completely. That you just see out and about.
Yeah.
100%.
Or friends, husbands.
Yes. But they don't tend to come to clinic, do they?
No, I think a lot of people put up with seborrheic dermatitis.
They do.
And don't think to go to clinic. So I suppose by seborrheic dermatitis, to clarify, that is this, dandruff, but also you get bits of redness around the nose, in between your eyebrows, a little bit of scale that goes with it. Often you might think it's dry, so you put a lot more moisturiser on it to try and cover it up and calm down the scales. And like Ellie said, if you rub your skin, then, bits of the scale come away. But it's really usually around the central part, beard, not necessarily if you have a beard, or scalp. But I think a lot of people put up with it. They just think it's just the way that their skin is and, nothing can be done about it. But I think it has a big impact on people.
Yeah. Do you ever say anything if you see someone at a party? Or
It's really difficult,
Yeah,
isn't
it's
it?
tricky.
I mean, going off subject, because this has nothing to do with men's skincare, although it is on a man's skin, so ever so slightly linked. When I was at the swimming pool on holiday, I saw a man, and on his back, he had a melanoma. Now, this was a barn door melanoma, and a decent size of a melanoma. And it is that question is, do you go and say anything? Because I've not been asked for my opinion. He might already know about it. He might not want to know about it because he's on holiday, but that is going to kill him.
Yeah, I would definitely say
and
something.
so, what do you do? So I actually had a bit of an ethical discussion with
Yeah.
the teenagers who were all there. One of the teenagers, my friend Ziggy's son, Seba, said, well, if you saw somebody about to be knocked down by a car, you would run and push them out of the way. So this is just the same, but in really slow motion.
Oh, what a great way of looking at it.
And I thought that's really good. So in that case, I did go and say, and it turned out it was melanoma and they didn't know about it. So we've communicated since and they're very happy with that. But at a party, I'm going to say to you, gosh, your skin's a bit red and scaly. This is how I can fix it. I don't know. I had an encounter today in the street with a man who had a really cute dog, but he also had seborrheic dermatitis, but I didn't tell him.
Yeah. Maybe they'll listen to the podcast. I can spread the word through the podcast.
Yeah. Man with the really cute dog. You could use Nizoral. What about aging of the skin? Okay, so this is a kind of bit of a gripe of mine.
Oh, go on.
A kind of like unfair thing, really, between the two genders in terms of their skin, is that men have more collagen, and on average, probably per age, if you were to like examine their skin at exactly the same time, because of more collagen and because they hold onto their collagen for longer, there can be around about 15 years difference for people of about the same age, because just that gender difference based on how their collagen is. So that's a bit annoying. Do you not think that these men just have more collagen and can stay younger for longer? The good thing is they don't use enough SPF, so their skin then can break down that collagen more quickly.
Yeah, not that we're competing or anything, but I do feel like they have a slight advantage. But I think maybe this is hugely generalising, but I do think women access healthcare. Well, that's proven, isn't it? Men don't access healthcare as much as women do. So women access healthcare. So they normally put in healthy habits more so than men would.
Yes. So if we were truly being
Balances out.
competitive, we shouldn't be advising them to use SPF.
Yeah. Don't worry about it. You're fine. Do you think there's an increase in men coming for cosmetic treatment?
I think there's an increased pressure across society in general to seek out cosmetic treatments based on probably the way social media and our general constant interaction with how we see ourselves and how our faces are filtered and the images that are displayed to us. I mean, and we can see the cosmetic surgery numbers just increasing, whether it's to do with injectable treatments or hair transplants or any of these things. But in terms of for men, yes. I mean, I have, more men coming to seek out treatments than ever before, really.
Yeah, I think so too, particularly for hair.
Mm-hmm.
So many men struggle with their receding hairline and, that androgenetic alopecia that they get. And now I think that they're seeking out help. I mean, there's so much more advertising, like, is this your scalp? Come and see us, we'll sort your hair out. But people don't realise that dermatologists are specialists within hair health as well as skin health.
And you're a particular specialist because you're the queen of regenerative dermatology, Ellie. So as we move into this idea, I always think of dermatology 3.0, where it's just not about fixing the problem that's in front of you. It's about preserving things for longer and utilising all aspects of our health. So hair is one of those things that, again, a bit like the beard, but this time it's on the top of the head, that will change for men over time. So what kind of treatments are effectively evidence-based that men could do in terms of their scalp hair health?
Yeah, so in terms of scalp health, the first thing to say is when you're shampooing your hair, you're cleansing your scalp. And so you want to try and exfoliate your scalp. And so shampoos that are very good at cleansing, I think, are best for men and women, but I think particularly good for men, with ingredients in it that slough off some of the scale, like an Israel shampoo with the ketoconazole that works as a great anti-inflammatory. I think in terms of shampooing, those are the steps I would take.
Could you be generic enough to say how often someone should wash their hair?
So I think there's a myth that if you wash your hair less often, that you somehow train your scalp to be less oily. But I don't believe that to be true. And also sweat and scale and debris builds up on the scalp in the same way that it builds up on our facial skin. We're advising cleansing twice a day of our skin. And so I'm not necessarily saying every day, but for most people, every other day of cleansing their scalp is probably the generic advice I'd give. But yeah, it would be more tailored to the person. Then there are some regenerative treatments that there's more and more emerging research for. So things like PRP, where we take a sample of blood, spin it down, take the growth factors from that, and then inject it into the scalp to try and stimulate hair growth. There are some medications that we can give by mouth that reduce the influence of the male hormone on the hair follicle to try and improve the hair growth. And then things like laser now, where we can combine laser with a treatment that goes into these little microchannels that we create with the laser. There are these regenerative injections called polynucleotides that's derived from fish, so salmon or trout DNA, highly purified and then injected into the scalp to try and improve hair growth in those areas. So I think things are moving on massively now. And I think more people are seeking healthcare, but quite rightly, because treatments have advanced as well.
That's right. And I think because people are typically trying to live as well for as long as possible, then, if we think that, by the age of 50, 85% of men are going to be experiencing hair thinning. So that is something that can often be quite sensitive for men.
Yeah, they are bothered about it for sure. Like some people aren't, obviously, but like lots of people are bothered about it.
What kind of treatments can be done at home? So like 5% minoxidil? Or?
Yeah, so you can buy Regain, which is minoxidil, and the foam, the 5% foam. I usually recommend that in women. I know we're talking about men, but the 5% foam is generally what I recommend people buy. You just have to be committed to using a product like Regain for hair growth because it stimulates more of your hairs to be within the growth cycle. But if you stop using it, then those hairs that have been promoted into the growth cycle then go into the shedding cycle. And so you may think that you're losing more hair, but it's just you've lost that benefit. So it's usually a sort of long-term commitment if you're going to start with things like Regain.
Yeah, because there's lots of these now. So Regain is just another form of this 5% minoxidil, which is used essentially to stimulate the kind of blood flow through the scalp and therefore start to stimulate the hair. And it can come in lots of different forms. So you can get sprays, you can get the foam, you can get lotions, often go alongside massage, although massage itself can stimulate your blood flow through your scalp.
Yeah, there was that study, wasn't it, where they looked at just injecting the scalp with like salty water with saline. And actually that stimulated growth as well, just because you're inducing a reaction in the scalp.
Yeah, I remember one of the other studies, they'd developed some kind of serum. I can't remember what the serum was, but that's not the important part of the story. But this serum that was considered a magic serum then had to be massaged into the scalp for 15 minutes every day. And then it was followed up to see what would happen. And there was an increase in hair growth. But it wasn't anything to do with the magic serum, but just everything to do with the 15 minutes of massage to the scalp every single day. So that would be like a super cheap way to kind of help out hair growth.
What do you think of those LED helmets for hair growth?
I mean, I have to say, in terms of LED or at-home light treatments for anything, I just don't really believe that the evidence is there enough. I do think that if we're in a kind of lab-based environment where, part of the skin is being studied in such a way with a certain level of LED on it, it might show some improvement. Whether that then translates into real life world improvement in hair growth, I am very, very unconvinced by that. What's your take on it?
Yeah, I just don't think the evidence is there at the moment. With the LED light therapy for people putting like the masks, in my head, I think if you're sitting there for 10 minutes and putting an LED light on, that's quite a relaxing time. You're not looking at your phone. It's 10 minutes of like you time. And I think that's got benefit in its own right. But I don't know how much benefit it has for the skin condition or for the scalp condition. I don't think there's any evidence to prove that it's beneficial.
One of my favourite podcasts, it's called Dermosphere. Do you ever listen to Dermosphere? Oh my gosh, I love it. This is for dermatologists to listen to, this other podcast, because it looks and talks about different journals and different papers that have just been published, and we'll look at them in great detail. But the two hosts of it, they're just really interesting, engaging, and they're super clever. So I love listening to this, and they take a different publication each week. But one of my favourite quotes from it, and I will use it when we talk about the LED lights and things like that, is that I've written it down because I just love this quote so much. So this is my take on what LED scalp lights are. There's some interesting basic science that says it has some potential, but not nearly enough to justify the claims of product manufacturers or social media influencers.
Oh, I love that. That's going to be our tagline for everything.
I know. So thank you, Michelle, for that. Do you recommend moisturisers for men? Does your husband wear a moisturiser?
He does, because it's got SPF in it.
Okay.
And so I have encouraged him to use that as his one-step moisturiser. And I mean, what he used to do when we first met...
Actually, tell me your husband's skincare routine. I want to know that.
Well, I'll tell you what it was before, it was in when I first met him. He used to use simple moisturiser, and he used to put it into the palm of his hands and then mix it with a bit of water and then splash that onto his face. That's how he used to do it. To wash his face, he'd use a bar of soap.
Actual real soap.
Genuinely. So things have modified now. So now he uses a cleanser.
Was that not the point where you just ran?
No. No, I was like, this is a challenge. I have to work on this guy. So now he uses a cleanser, and I think that's an important part of the skincare routine. And then a moisturiser that has SPF in it, because it's just simple and straightforward. And the one he's using at the moment is the Ultraist one. Or the CeraVe one. CeraVe have got a nice moisturising lotion with SPF in it as well.
So my husband washes his face with Cetaphil Gentle Cleanser, same as me.
Very good.
He moisturises his skin with Aveeno, which he has done literally all his life.
Forever.
And he cannot part with it and absolutely loves it. And then his SPF is infrequent as well.
Oh.
He'll be good in the summer. No, actually, that's not true. He will be adequate in the summer.
Yeah.
But he won't wear it during the winter at all. Even though it's sat out, because it has to be sat out because I'm going to be using it. Yeah, he just won't. So I just think that nice little quote I said earlier, you've got more collagen, but it's going to go.
Yeah. And you're winning. So perfect.
And then at night, he uses his Clear Special. And the thing is, so he had rosacea, quite marked rosacea, I'm going to say. He would go to the gym and his face would be red and blotchy afterwards for, a good 4 or 5 hours, not just a little bit, a long time. If he was in meetings, his skin would be red. He never had the papules and pustules of rosacea, but he'd have more of the blotches. Mm-hmm. And I know that it really did bother him. And despite the fact of being married to a dermatologist and being given constant advice as to what he should do for it, he just continued to not put his SPF on and just use his Aveeno. Until finally, whenever so many of his friends were there on board with the treatments that I was doing, he said, okay, well, can I have a go at this? And then he started on his Clear Special with ivermectin and tretinoin and azelaic acid.
And his skin's gorgeous now.
And he's so happy.
Yeah,
and
of course.
It's the little things he said. He would go and do a Peloton, say, for an hour. And then afterwards he'd be, I can't go out,
until his skin's
calmed down. Or, okay, I'm not going to do a Peloton because I know that we're going out for dinner.
Yeah.
And now he just doesn't have that at all.
Yeah.
And his skin is just much more reliable. So I think that sometimes men really do put up and not even realise it's a medical problem, but really put up with their skin bothering them without seeking out the help to get it, even though all of that help is there.
Yeah, even though you might be married to the help.
That's what I mean. Even though you see this right in front of you every day. I was like, are you mad? And then, I see him now really enjoying and being happy with his skin. So it does, yeah, exactly. You're married to the dermatologist.
To the help.
You're actually being given advice and you're not taking it. Crazy guy.
I know. Madness.
So typically, and we are talking generically and typically here, it's very hard to do a gender split it across. But if we are thinking about a kind of minimal approach to skincare, we're all about minimal approach to skincare.
Yeah.
What products do you think about in terms of cleansers, SPFs, moisturisers, nighttime treatments?
Yeah, so in terms of a cleanser, depending on how their skin is, usually something like a hydrating cleanser, so CeraVe hydrating cleanser or the Cetaphil gentle cleanser. If they've got very sensitive rosacea, redness prone skin, then I normally recommend something like the La Roche-Toleriane cleanser. And then after cleansing, usually a moisturiser. So moisturiser, either something like a gel or a serum or lotion rather than a cream or an ointment. And then again for their SPF, something like a gel or something that can just sink into the skin really nicely and easily and doesn't leave like a film or anything, because I just can't imagine they like that when they've got, you know, oily skin with facial hair. And then for their SPF, I like the ultraviolet brand, La Roche UV Immune, as we always talk about.
And the Ultrist?
The Ultrist, yeah.
I do love the Ultrist ones. They're really nice, aren't
Lovely
they?
range, yeah. I like their face fluid, so that's lovely. Just goes on. And then they've got their hyaluronic acid moisturiser that's got SPF in it.
Yeah, I recommend all of those ones as well. I think they're brilliant. So I would go for, in the morning, a Cetaphil Gentle Cleanser. I'm kind of like just going to probably read out my husband's skincare routine.
It's been perfected.
It's been perfected. So obviously this doesn't suit everybody. If you want to know exactly what's the right thing to use for your skin, you could do the skin consultation at cleara.skin and then you'll know for you. But I would recommend the Cetaphil Gentle Cleanser. Moisturiser, I totally agree. Usually these lotions are better than creams, aren't they?
Yeah.
So the CeraVe lotion I really like. Anything with a lotion in it typically tends to be better. The Aveeno lotion or cream, that's a pretty light cream. I think that vitamin C is not to be forgotten and serums can be really useful. So remember, we might use a vitamin C antioxidant to reduce that oxidative stress on the skin, and that would go on before your SPF. And then at night time, depending on what your skin's needs are, you might need a prescriptive treatment at that point. So wash the skin, put on the prescriptive treatment. That would be my kind of order.
And the order of skincare is the same, irrespective men or women. So usually start with the lightest formulation. So like go from your serums or like the watery types of products onto the creams. And then your final step of your morning routine is always your SPF.
Perfect.
So in a nutshell, men's skin, exactly the same as women's. They've got thicker skin, bigger pores, bigger glands.
And hair.
Slightly more oily and hair. So considerations that we have to bear in mind are those.
So it's almost exactly the same as women's. The only difference is a lot of marketing and probably a few more hair follicle units and oil.
Yeah.
It's easy.
Done. Tick.
Okay, well, I think that's a wrap for this episode. Thanks so much to Ellie for joining me.
Thank you so much for having me. Loved it.
And thanks to you, lovely listener, for joining us. And in terms of skin type, that's something that we're going to cover in a whole other episode. So how you can actually work out what type of skin you have. If you haven't already, take a moment now to click on the subscribe button so the next episode will pop up like magic in your feed. And see you next time on the After Hours Skin Clinic.